quiz video on gastroenterology. My first question is, who are you and what is your title?
Hi, my name's Dr. Stephen Fong. I'm a consultant gastroenterologist and also clinical lead for the gastro department here at East Sussex NHS Healthcare Trust.
And how did you become a gastroenterology consultant?
Starting on in my medical career as a registrar, I knew I definitely wanted to subspecialize in an acute specialty, something with a lot of acute medicine. So it was really a toss-up between cardiology, respiratory, and gastroenterology. And I felt gastroenterology with its procedures and variety was what I wanted to do. So I went to apply towards that specialty.
Good answer. And what do you do on your average day?
Well, in the average week, if I'm the ward consultant, I will do a ward round and see sick patients on the mornings, so Monday to Friday. In the afternoon, I may be seeing inpatient ward referrals from other specialties who have a gastro case to be seen. On a Wednesday afternoon, I'll be doing a afternoon clinic, which I normally see a few face-to-face patients as well as some telephone clinic patients. On a Thursday afternoon, I do endoscopy, and sometimes on the weekends, I may be on the GI bleed on-call system where we have to do endoscopy for any acute GI bleeds that come in over the weekend. So that's my week in a nutshell.
Oh, interesting. And what happened to you on your most interesting day at work?
Well, every day is quite variable, but only last week in the morning, I was taking out several batteries from someone's stomach. In the afternoon, I was scoping a very severe GI bleed with a lot of variceal bleeds and a bleeding ulcer, which we had to clip. And after that, I was seeing a patient on the ward that had a very unusual gastro problem that we required to refer him up to King. So, the day can be very variable, and we do a lot of procedures and we see some interesting things. Yeah.
Thank you. And what advice would you give to someone looking to get into gastroenterology?
It's competitive, as with a lot of specialties, so you do need to work hard and make sure you have a very good and broad-ranging CV so that you have the best chance of having a successful application to gastroenterology. I think it's always good for you to actually have a taster in gastroenterology to see that it's definitely what you want, but it's definitely a competitive specialty, so you need to prepare well in advance to make sure you've got the right credentials to have a successful application.
Thank you. And finally, why should someone choose to work in gastroenterology?
I think if you like a large degree of variety in your job, as long with a lot of acute medicine and patients who are sick, a lot of action, then it's a good specialty for you because no day is ever the same. I really enjoy my job and I really do enjoy every day I come in. And I think it's because of that variety of medicine that I see.
Excellent. That's all my questions. Thank you so much for answering them, Dr. Fong.
You're welcome.